Good morning, ma'am.
Good morning. Okay, let's work. Hormonal regulation. If we will compare with you neural regulation and humoral regulation, we are talking that humoral regulation has diffuse action, information transfer not by nerve fibers, here will be moved by fluids, by blood. Transport of signal will be slow, 0.5 meter per second. It means that speed transferring of blood by our cardiovascular system. When we are talking about humoral regulation, we are talking about long time period. Of course, it depends on structure of hormones, type of hormones, because some of hormones working short time periods, the same how neural regulation, but most of them has prolonged action. And depends on blood flow and transport proteins. And we say that humoral regulation hormones action working according to the law. Who are hear me? It means that everyone who hear me will receive signal. What does it mean here? It means that we are talking about receptors upside of cell. If receptor consists of if cell consists receptor for this hormone, of course, this cell will receive information and signal from humoral regulation. As I say, when we are talking about hormonal regulation, we are saying about action on target cells. This is important. Target cell, this cell with receptor to some hormone. On the picture, you could see main glands, endocrine glands in our body. Here we are talking about thalamus, pituitary gland, this main axis of regulation, and after our peripheral glands like thyroid, parathyroid gland, thymus, pancreas, adrenal glands, and of course we are talking about ovaries for female and testes for male. Main information: hormones synthesized by specific tissue, endocrine glands, secreted directly into bloodstream, specifically alter metabolic activities of target cells. Active at very low concentration, this is important also, and rapidly metabolized as usually short-lived effect, but of course if you compare with neural system, this will be more a long time of effect. Important moment that as usually it's working by a next system. Signal induce releasing of hormone make action on the receptors as usually has transductor or after to the effector we have releasing of second messenger. A second messenger induce some action inside of the cell, but this not for all hormone. This action, what is the difference, we will say with you. This is main scheme of all our humoral regulation inside of our body. I would like to pay your attention that anyway in the top of this regulation we have with you central nervous system and hypothalamus. Again, I remind you, hypothalamus, this is part of limbic system, and this is a higher center of regulation of our visceral function. This is important, hypothalamus. And hypothalamus divided by anterior pituitary and not divided. Hypothalamus has effect on hypophysis or pituitary gland is the same. We have anterior and posterior part. Anterior release most of tropic hormone. Posterior not created any hormone. This is important. Posterior pituitary gland released hormones from hypothalamus. This hormone here we have vasopressin and oxytocin. If we will talking about classification hormones according to their chemical structure, we can say they divided on derivate from amino acids, peptides and amino acids, and steroid hormones. Also, when we are talking about hormone transport, here is important, and transport and action. All hormones in our body we can divide for two groups. First one, these water-soluble hormones. Second, lipid-soluble hormones. This is important for transportation of this hormone, and also this is important for mechanism action, because water-soluble hormones can make their action only upside of cell membrane, their receptors only upside of the cell. Lipid-soluble only inside cell. They're easy for transferring through the lipid membrane and moves inside of our cell. Here we have lipid-soluble hormones. Their receptors located or in the cytoplasm or in the nucleus. This is main difference between water-soluble and fat-soluble. Again, look, water-soluble hormone cannot move inside of the cell. They can make action only upside cell membrane receptors. Fat-soluble, they easily moves through the cell membrane and moves into intracellular receptors. Important moment also that water-soluble hormones, they not need transporter, but fat-soluble hormone without transporter cannot move by our blood. Important also. When we are talking about water-soluble hormones, we are talking about they are working as first messenger, and inside of the cell, they induce action of and activation of second messengers. Second messengers, this is little bit biochemistry. Second messenger inside of our cells could be CAMP, CGMP, diacylglycerol, inositol 3-phosphate, and calcium. This example how is working a cascade of chemical reaction through the second messengers. You could see here some non-steroid hormones. It's mean water-soluble. Again, I would like to turn back here. Look, lipid-soluble. This is this case we are talking about steroid hormones and thyroid hormones. Other hormones, they are water-soluble. Steroid hormones, these hormones, sex hormones, this is hormones of our adrenal gland, cortex of adrenal gland. Here we are talking about cortisol, aldosterone, and sex hormones. And plus thyroid hormones. This is lipid-soluble hormones. Important moment, so please take it. Other option, other variant. So here we have activation through the CAMP, through the adenylyl cyclase system. We have through the IP3 diacylglycerol activation releasing of calcium, working as second messenger. Calmodulin system also through the directly action of free calcium, activation of calmodulin, and after we have a combination calmodulin complex with calcium and inactive enzyme. After we have activation of enzyme, and we have some transferring from substrate to product. Lipid-soluble hormones, steroid hormones, example what I say, the sex hormones, glucocorticoid, mineralocorticoid, thyroid hormones, and also important vitamin D. Sometimes in like nowadays, they are talking that vitamin D able working as hormone, not only like vitamin, but after transferring in our body, it works as a hormonal substance. Important moment that for steroid and thyroid hormones action, steroid hormones has receptor in the cytoplasm, cytosolic, but thyroid and vitamin D in the nucleus, nuclear receptor, and directly has action on the DNA, on the DNA. That's why now you already understand that if we will compare with you water-soluble and fat-soluble hormone has effect on DNA. Water-soluble, no, only through the second messenger on some activity inside our cell. This is about fat-soluble hormone you see in cytosolic receptor or a nuclear receptor. Next picture. You could see main axis regulation all of our hormones inside of our body. This is so important for your future for understanding this axis. It means that every hormone which come inside of our body or synthesized inside of our body, all time this hormone included in the cycle of self-regulation. What I mean? If, for example, we will take with you insulin, it's only like example, inside of our body from outside, some people use it for lose a kilogram or for some other not so clever things. What will be happen? I not mean now about treatment. I mean that everything is clear working and we putting out from outside hormone. It means that our own hormone will be stop production because we have feedback loop. If final hormone is enough, it will be inhibition of previous hormones which stimulate its production. If we will use with you thyroxine, for example, also from outside, our own thyroxine will be stop production. If we will use with you testosterone from outside, our own testosterone will be stop its production. It means that when we have normal hormonal production, we should not use any extra hormones. Other case, our hormone will be stopped working. So in front of you, main regulatory axis of hormones. We can see main hypothalamus produce releasing hormones. Here we are talking about liberins and statins. Liberins and statins has influence on the anterior pituitary gland. Anterior pituitary gland produce trophic hormones. Trophic hormones always stimulative hormones. Trophic hormones has influence on the target organs. After we have activation and production of peripheral hormones, these peripheral hormones has physiologic effect. And these peripheral hormones has feedback effect on the anterior pituitary and on the hypothalamus. So, example, with hormone thyroid glands, hypothalamus release thyrialiberin will induce stimulation of anterior pituitary gland. Anterior pituitary gland will release thyrotropic hormone, TTH. This hormone always will be stimulative hormone. Stimulation production by thyroid gland, T3 and T4. T3, T4 will have physiological effect on our body, metabolic function, and so on, and feedback negative feedback on hypothalamus and pituitary anterior pituitary gland. This main thing in hormonal regulation. Let's move. Most of hormones we have by feedback, not most, all hormones we have feedback regulation. Some hormones like prolactin has, this is so rarely we can use this. Prolactin has positive feedback regulation. Then more prolactin, then more milk, breast milk. Then more breast milk, then more prolactin. This is so rarely happens. Most of our hormones regulated with negative feedback connection. Hypo and hyperfunction. Here we are talking about disease. If we are talking about hypofunction, we have less hormones than normal. If hyperfunction, more than normal. On the picture, you could see what is going on with growth hormone in case of hyper and hyperfunction. Example from Krok question. 32-year-old patient consulted a doctor about the absence of lactation after parturition. Such disorder might be explained by the deficiency of the following hormone. If we are talking about lactation, how I said you already, how I have said before, we are talking about prolactin. More. A 26-year-old woman at 40 weeks pregnant has been delivered to the maternity ward. Objectively, the uterine cervix is open, but the contractions are absent. The doctor has administered her a hormonal drug to stimulate a labor. Here, important moment. Let's look. Anterior pituitary gland. How I told you, they produce this part produce stimulative hormone, tropic hormone. Posterior release hormone from hypothalamus. Two hormone. Oxytocin. Oxytocin, this hormone of pregnancy and labor. First of all, we are talking about working of mammary glands, secretion of mammary glands, milk, and we are talking about smooth muscle, uterus, smooth muscle contraction. Also has other function, has a function for our behavior, for our feeling, and so on. But this case, we are talking about visceral function. This is about labor. So our answer will be here about oxytocin. This you should remind. If we are talking about second hormone, here we are talking about vasopressin or antidiuretic hormone. Vasopressin or antidiuretic hormone. Antidiuretic hormone, you already could understand from the name what is the function. Opposite to diuresis. It means that this hormone not giving to release water from our body. So water volume should be increased in the cardiovascular system. It means that this hormone will be increase blood pressure, will be decrease osmotic pressure, because then more water, then less osmotic pressure. Antidiuretic hormone, other name vasopressin. Vasopressin, it means vessels, pression, pressing. It means the second function of this hormone, this is contraction of the vessels and also so increasing blood pressure. Main hormones, adenohypophysis, growth hormone, thyreotropic hormone, gonadotropin. Let's move. Growth hormone or somatotropic hormone, same name. In childhood time, if so much growth hormone, we have giantism. If hyperfunction, we are talking about dwarfism. It means that this hormone is responsible for linear growing of our body. But important, pay attention, only in childhood. Because in adult time, we not have linear growing. That's why this hormone will have another action. For adult people, we are talking if hypersecretion will induce obesity and muscular dystrophy. It means that for adult person, this hormone responsible for metabolism of proteins. And if lack of growth hormone, we will have muscular dystrophy. From right side, you could see other story. Here we are talking about hypersecretion of growth hormone for adult person. Here we're talking about disease is named as acromegaly. Acromegaly disease, what is going on, you could see on the photo and picture. We are talking about bone growth. What kind of bone? We are talking about low jaw growing. Look, this picture of the same man who ill for acromegaly, and look how is changed his low jaw. You see, growing. We have enlargement of lips, nose, ear, because here we are talking about growing of cartilage tissue. And also happened cell tolerance to glucose. Cell tolerance to glucose is reduces. Example from Krok question. Examination of a patient revealed overgrowth of facial bones, how I told you, low jaw, tongue enlargement, soft tissue enlargement, wide interdental spaces in the enlarged dental arc. What changes of the hormonal secretion are the most likely? So we already know that we are talking about hyperfunction of growth hormone, or other name, somatotropic hormone. Contour of biological regulation of our growth hormone, the same story, hypothalamus, hypophysis. Hypothalamus release liberins, stimulation, statins, inhibition. It controls somatotropic hormone production. After somatotropic hormones can have directly influence on our bones and our muscles, or most of action through the hepatocytes, and hepatocytes release somatomedins. Also remind this name, please. Somatomedins, this hormone which produced by our liver. After production of somatomedins, this somatomedins has action on body linear growth, physical development, and inner organ size. If person has decreasing of growing in childhood time, this time we are talking that possible we have problem in somatotropic hormone production, or problem in the liver, and problem for production of somatomedins. Also, look please, ELGF, what does it mean? Insulin-like growth factor. This name you also can meeting in the question and in your future life, of course, a professional. So in hepatocytes, somatomedins mediate somatotropic effect on different target cells. Somatotropic action through the somatomedians, we have activates protein synthesis in chondrocytes, enhances protein synthesis in muscles, and leads to the increase of body weight, activates protein synthesis in the majority of organs, cause their enlargement. Without somatomedians directly effect of somatotropic hormone, elevation of the glucose level in blood, diabetogenic action. That's why, by the way, for children time, when their period of growing have their sugar in the glucose level in the blood higher than normal. And this is normal for this period of years. Increase of lipolysis, stimulation of protein synthesis in muscles, resulting in the increases of body weight. Role of the thyroid hormones. Role of the thyroid hormones in the control of thyroid hormones control for us physical, psychical development, metabolism intensity, and function of circulatory and respiratory system. First, what I want to underline for you, thyroid hormone, this is only one hormone which responsible for psychical and nervous system development. Only one hormone which directly has influence for this function. Our thyroid gland release three hormones, T3, T4, and calcitonin. It's everything happened under TTH influence, thyrotropic hormone influence, but from opposite on the dorsal surface of our thyroid gland, we have with you parathyroid glands. Parathyroid glands release parathyroid hormones or parathyrin. This hormone responsible together with calcitonin responsible for calcium level in our blood. T3, T4 responsible for all function what is mentioned upside of this picture. T3, T4, this is a scheme of regulation. I already told to you that. T3, T4, this is hormone, lipid-soluble hormone. The receptors located in the nucleus and has directly influence on DNA. Function of thyroidal hormones, body growth regulation. This important because normal linear body growth is possible only in the present thyroid hormones. If will be lack of thyroid hormones, body growth will be not happen even if growth hormone is okay. In adults, thyroid hormone responsible for central nervous system excitation. If lack of this hormone will be retardation, sleepiness, memory impairment, mental dysfunction. Okay, this is also influence on autonomic nervous system. So often you can meet this question. Look, thyroid hormones induce synthesis of adrenal receptors. So, then more thyroid hormones, then more effect of a sympathadrenal system on our body. Also so important function. Then more thyroid hormones, then more adrenal receptors, then more adrenal receptors, then more our body sensitive to sympathadrenal system. And of course, the main function, this is basal metabolism effect. Because our thyroid glands responsible for basal metabolism. If we have lack of thyroid hormone, we have decreasing of basal metabolism. Also has effect on increasing of respiratory ventilation and cardiac output. Why? Because it's also metabolism. When we are talking about respiratory ventilation, it means more oxygen. Oxygen we need for metabolic process. If we are talking about cardiac output, we are talking about transportation of oxygen. That's why also we are talking about metabolic process. People who have thyroid excess production feel bad when there is a hot weather. They cannot stand hot weather with hyperproduction of thyroid gland, and opposite, they all time feeling frozen when have lack of thyroid gland. Also responsible for glucogenolysis, gluconeogenesis, protein synthesis and degradation, because we are talking about catabolic process also. And also, I want again underline function for stimulation working of nervous system for adult people. For children time, we are talking about development of nervous system, not working, but development of nervous system depends on thyroid hormones. Example, look please on the picture, what we are able to see, hyper and hypofunction. Hyperfunction, its name as Graves' disease. Graves' disease. What we have here, weight and muscle loss, increased appetite, diarrhea, nervous irritability, so nervous, so hyperactive people, and of course, exophthalmia. Exophthalmia, you could see specific face of these people with Graves' disease. So here we are talking about increasing all process of metabolism, plus here we have increasing sensitivity to sympathadrenal system. That's why people nervous could have some trembling, they have increasing of blood pressure and so on. And opposite story is named as myxedema. Myxedema or hypofunction of thyroid gland. People so slow. They have obesity or overweight. Alopecia, they're losing eyebrows, they're losing hair. They have goiter, increasing volume of thyroid gland. This is all named as myxedema. Example, so many questions about this disease in your Krok questions. That's why let's look. Clinical examination of female patient revealed reduction of basal metabolism by 40%. Again, in body mass, drop of body temperature, what I told you about temperature. Face puffiness, sexual dysfunction, inertness, and apathy. Lowered intelligence, cognitive function decrease. These symptoms are caused by dysfunction of the following endocrine gland. Of course, if we are talking about some intelligence, cognitive functions, mental function, so on, first of all, we are talking about thyroid gland. And all these symptoms talking to us, saying to us about myxedema, so hyperfunction of thyroid gland. Here on the picture, you could see goiter. Goiter, we are talking here about hyperfunction of thyroid glands because of lack of thyroid hormones. As usually, lack of thyroid hormones, we have two reasons. First, deficiency of iodine. This so often can be happen because in our meal could be lack of iodine, and that's why our goiter our thyroid gland cannot produce enough hormones, because T3, T4 in their chemical structure, you know that inside have iodine obligatory. Look, question. 19 years old female suffers from tachycardia in rest condition, weight loss, excessive sweating, exophthalmos, what I told you, and irritability, so nervous. What hormone would you expect to find elevated in her serum? We are talking about thyroid hormone. Childhood time, we are talking about other disorders. If we are talking about decreasing of thyroid hormones in childhood time, this time we are talking about illness with name cretinism or mental retardation. You could see picture and photo for children with lack of thyroid hormones. As usually reason, this is lack of thyroxine from birth or before birth, lack of iodine in mother body. This is the most important. Here we're talking about reduced growth and function, many of organs. Physical growing is violated. And first of all, mental growing is violated. These people, these children, has disorders and violation of cognitive function. Question from Krok. A child present with symptoms of psychic and physical retardation, cretinism. It is usually associated with the following hormone deficiency. Of course, we are talking about T3, T4 here. We are choosing thyroxine. I would like to pay your attention, for example, what happened with children. I like this picture. Look, please here. These two girls, they are 8 years old, both of them. One is normal girl, other one, this is girl with deficiency of iodine better we'll say with T3, T4 deficiency. 8 years old both. You see violation of growing, first of all, but look this face of this girl. And why you want to pay your attention? Because this is the same girl, this ill girl, same, during exposition of thyroid hormones, during treatment. What does it mean? It means that thyroid hormones increase development of this baby. But what is important, that it's too late. If it happened, this treatment happened, for example, in 3-4 months old after birth, this will be super and will be treat these children. But this time it's too late for development of nervous system and mental function. What else? One more gland. We are talking about thymus. Thymus, this is main important gland for childhood time. Thymus, this is temporary gland, because for adult time this gland is not working, decrease its work till 20-25 years old. Thymus produce hormone, peptide hormone, thymosins, hormones better to say, because there are nearly 20 different type of substances. Function of thymus hormone. Thymosins play a major role in the differentiation of T lymphocytes, which provide cell-mediated immunity and promote production of antibodies to provide humoral immunity. Also plays a major role in development of immune system, and it's degenerated in old individual, leading to decreased production of thymosin and weak immunity. So when we are talking about immune system, development of immune system, we are talking about thymus. It's not only one function, because thymus and thymosins also important for process of growing. For example, it's additional information for you. Thymosins can inhibit sexual development. This is important for because from the moment of sexual development, our linear growing is stopped. That's why these hormones inhibit sexual development for giving time for our body for linear growing. Also important moment. Example from questions for the Krok. Teenager was irradiated with a high radiation dose that resulted in serious damages of lymphoid system. Lysis of many lymphocytes. Restoration of normal hemogram is possible due to the functioning of the following gland. When we are talking about lymphocytes and some damaging for children time, teenager, we are talking about thymus. Sex hormones. Hypothalamus, anterior pituitary gland, and our sex glands. When we are talking about humoral regulation for women, we are talking about men. We are talking. I'm looking for the right picture. If we are talking about men, we are talking about the next regulation. Anterior, by the way, for men, for women, this way same. Anterior pituitary gland release FSH and LH, follicular stimulative hormone and luteinizing hormone for women and for men. FSH for men stimulates Sertoli cells. Sertoli cells responsible for spermatogenesis and release hormone inhibin, which by negative feedback connection decrease function of anterior pituitary gland. LH stimulate Leydig cells. Leydig cells release for us testosterone. Testosterone for men responsible for spermatogenesis. Testosterone also, pay attention, has feedback, negative feedback connection to anterior pituitary gland and hypothalamus. What I want to pay your attention, when we are talking about using extra testosterone, for example, you know, bodybuilders, this is huge man with so much volume of muscles. This is not normal. They are growing their muscles with using of proteins, amino acids, and of course extra testosterone. When extra testosterone moves in the body, what will be happened? Body will receive testosterone. It's okay, testosterone will be working, but high concentration of testosterone in the blood will working by negative feedback and will induce inhibition production of FSH and LH. What does it mean? That spermatogenesis for this man will be stopped. You should know this, you should understand it. What I told you, all time when we are talking about hormones, we are talking about negative feedback connection. If more than need peripheral hormone, stimulation of production, this hormone will be stopped, will be decreased. And people who used testosterone steroids, we say steroids, for stimulation their body growing, they have problem with spermatogenesis. Their testes will be stopped their working. This is fact, you should know it. Testosterone for men responsible for bone mass density maintenance. This is important all sex hormones and for men and for women. When level of sex hormones is decreased, we are losing bone mass density. Calcium moves out from our bones. Please memorize this. That's why for our grandmom, granddad, they have as usually problem with bones. So often can be broken their bones. Why? Because sex hormones is so much decreased, and for them so important to have extra source for calcium and vitamin D. Also, testosterone, first of all, important for muscles. You could see muscle of men and women, and you very good know that muscle for men growing much more better than for women. Why? Because we are talking about testosterone, metabolic process for proteins, so much increase because of testosterone function. Skin, hair growth, collagen growth, young face, testosterone. Brain, increased sex drive, improved mood, confidence, and memory function, testosterone. If testosterone low, all this function will be violated. Bone marrow, red blood cells production under testosterone is stimulated. Then more testosterone, then more red blood cells. If we compare with you red blood cells quantity for men and women, for male and female, you will know, you will see that erythrocytes for women, hemoglobin for women, lower than for men. Why? Because testosterone. Of course, we are talking about sex organs. Here we are talking about sperm production, erectile function, and prostate growth also under testosterone. Women, here is complicated story because not only testosterone, women have cyclic production of different hormones during months, little more or little less. Every women with sexual gland, functional sexual gland, all women has cycle production of hormones. Every cycle starting from increasing follicle stimulative hormones because stimulate growing of ovaries, follicles, increasing estrogen under FSH. I will turn back here. Under FSH, we have stimulation of estrogen production. Estrogen production on the top. The same time, we have top of LH. LH hormone induce ovulation. During ovulation, cell moves outside to the uterus, but at the same time on the place of follicle we have growing of yellow body. Yellow body produce progesterone. Progesterone, this is second phase of cycle. Progesterone should be growth. Progesterone need for two reasons. First reason, progesterone induce inhibition of new follicular development in case if woman is not pregnant. So progesterone will be working till the end of cycle. And again, progesterone down, we have start of new cycle. In case of pregnancy, progesterone stopped follicle growing till the third, fourth months of pregnancy. After will be working other additional progesterone. But this is function of progesterone. Let's look for the question. Usage of oral contraceptives with sex hormones inhibits secretion of the hypophysis hormones. Secretion of which of the indicated hormones is inhibited while using oral contraceptive with the sex hormones. When we are talking about sex hormones violation and using of oral contraceptive, we are talking about inhibition of follicle stimulating hormone, FSH. Decreased, ovulation will not happen because not happen development of follicle. I also pay your attention for the question of oral contraceptives. Never thinking that it's easy, it's not important for women body. This is important because when woman using these contraceptive pills, what will be happen? All her cycle will be broken. Again, pay your attention that action happen on hypophysis hormones. And hypophysis hormones, I want to again you look, this is not only these hormones, and will be violated and broken regulation all of hormones in hypophysis. Not possible to targeted influence only this hormone, as usually will be discoordination work of all hormones in woman body. That's why thinking about it when we are talking about oral contraceptives. Second question, a female patient present with endocrine dysfunction of follicular cells of the ovarian follicles resulting from an inflammation. The synthesis of the following hormone will be inhibited. If we are talking about follicles, we are talking, of course, about production of estrogen, because follicle produce estrogen, but yellow body produce progesterone. Sex hormones for women, estrogen, important for brain, because here we are talking about libido adjustment and memory function. We are talking about body temperature adjustment. We are talking about breast growth for teenager time and feeding function after. We are talking about cholesterol production regulation. By the way, this difference between men and women, cause estrogen protect woman from the high level of cholesterol. Men cause not have estrogen, they have violation, as usually after 30-40 years they have a problem with cholesterol growing. But women, as usually, if everything normal with hormones, they beginning have cholesterol production increasing only in menopause time when sex hormones is decreased. Also, bones density, how the same for testosterone, protects heart and vessel from cholesterol, how I told you. Anti-aging effect, then more time, the more long time women has higher level of estrogen, then more young her face and her skin. And of course, we are talking about uterus and monthly preparation for pregnancy. Every cycle, women body prepared for pregnancy. Every month. One more gland, pineal gland, which release melatonin. Pineal body or epiphysis or third eye. Few words about this hormone. Here released melatonin. Melatonin and serotonin. From serotonin, we have creation of melatonin. Melatonin releasing only in the night time. From 10 evening till 3-4 night, like that. Melatonin is so powerful antioxidant. With the particular role in the protection of nuclear and mitochondrial DNA. All troubles what happened and mistake what happened in DNA in our cells can be repaired by melatonin. Melatonin responsible for our rhythm of sleep. Melatonin has, it's proved already that melatonin has so high effect for protection from oncology disease, from cancer. Again, want to underline for you, this is so high antioxidant. That's why please pay your attention that we should go to sleep in time, for we have good production of melatonin, and for our body will be more healthy. Also important things, melatonin produced in darkness and inhibited by light. That's why if you are sleeping together with laptop, open it, and so many some lights everywhere of your nearly, and open windows, this is not healthy decision, because this time melatonin production is decreased. And also, again, paying your attention, melatonin can release only from 10-11 evening till 3-4 morning. That's all. And doesn't matter if you decided go to sleep after 12, after 2 night, and sleeping till 10-11, it will not help for you for creation of melatonin. Take care of your health. Continue our hormones. Hormonal control of homeostasis. Main hormones: regulation of glucose level, insulin, glucagon, regulation of osmotic pressure and blood pressure, this aldosterone and vasopressin, regulation of calcium inside our body, parad hormone, calcitonin, calcitriol. Let's look what we have here. So, regulation of glucose. Please pay attention for the level of glucose, normal level of glucose. According to norm, we should say, by the way, it's usually we are measuring glucose level in millimole per liter. So many countries measure in milligram per deciliter. That's why this is difference of numbers. In our basis, in our question, it will be millimole per liter. So please, norm for our glucose 3.9 till 5.6. This is for adult, young and adult people. Question: patient with diabetes mellitus experienced loss of conscience and convulsion after injection of insulin. What is the result of biochemical blood analysis of concentration of the sugar? You know that people with diabetes mellitus, they are using for their life, they are using insulin. And so often with not without experience people, they have problem with regulation of using insulin. If they use wrong dose of insulin, their level of sugar will be so decreased. This is so dangerous, first of all, for our brain, because we know with you, we remember with you that our brain, our nervous cells, they are using what? They are using glucose for energy, and only glucose. That's why when we have lack of glucose, first of all, we have problem with work of our nervous system. So we have two main hormones. They're responsible for glucose regulation. If we have increasing of insulin, this time we have synthesis of glycogen, fat synthesis, protein synthesis, glucose oxidation. When we say that, but when it's happened, when glucose level in the blood is up, when glucose level in the blood is down, this time we have working of glucagon. So we need increased level of glucose. glycogenolysis, gluconeogenesis, ketogenesis. We have dividing of glycogen, we have dividing of fats, and we have creation new glucose from amino acids, for example, for increased level of glucose in the blood. This is happen under glucagon. So this case, what we see in the question, we understanding with you that this is low level of glucose. From all this number, this is right answer will be, where is the lowest level of glucose, will be 1.5. By the way, before, like 10 years ago, level of glucose, normal level glucose, was from 3.3. Was from 3.3, now from 3.9. Why could it happen? Because it depends on quality of life and quality of food of people of some country. Level of glucose in different country could be different as norm. I don't remember now which country, but some European country has higher level norm of glucose, 7.2. When we have 7.2, we are talking that it's starting of diabetes mellitus. This is not normal, but some of them say that this is okay. My advice for you, for your life, for your future, to pay attention. 5.6, 5.5. This should be higher level of glucose for you or your patient. If it's growing up till 6, it's not mean disease, but it means that this is time for pay attention for glucose level. Why do we need with you insulin? What is the problem insulin? First of all, insulin, this is only one hormone in our body which is able to decrease glucose level in the cell. In the blood. Only one. All other hormones, they're increasing level of glucose in the blood. Only insulin could decrease. Why do we need with you insulin? Because without insulin, glucose is not able to move inside cell. Not because important for us level of glucose, but because without insulin, glucose not able to move inside cell. Insulin, look what is going on. Insulin after activation, insulin receptor after activation by insulin induce movements and releasing transporter for glucose. This transporter is named GLUT4 or GLUT4. This transporter by exocytosis way will integrate this GLUT4 in the cell membrane, and it will be way for moves glucose into the cell. Without it, glucose is not able to move inside cell, any cell. That's why our cell will be hungry. We say that cell hungry, they not receive source for energy, because main source for energy inside of our body, this is what? This is glucose. And if cell is not able to receive carbohydrate, not receive glucose, should be eating something else. What else? In cell, we have for extra some production only lipids. If cell begin to use so much lipids, it induces releasing and production of ketones in the body. Ketones is so dangerous and toxic substance. That's why started all problem in the body. Okay. Example question. Before glucose is utilized by cells, it's transported inside cells from extracellular space through the plasmatic membrane. This process is stimulated by the following hormone. We know with you, this is only one option. This is insulin. In the you could see what is going on, how I explained you before. I would like to pay you one more moment that some tissue they're able to use glucose without insulin, because this cell all time have transporters for glucose inside a cell membrane. This is liver cell hepatocytes, and this is muscle cell, because muscle can use it glucose without insulin. And this is our nervous cell. They not need insulin for consumption of glucose. This is important protective mechanism for us. But in the muscle and in the liver, normally glucose should be converted to glycogen. Conversion without insulin will be not happen. That's why consumption can be, but for only now, right, this time using. If we want to save and make a store for glucose, it is not possible without insulin again. Contour biological regulation, the same. Plasma glucose increase, it will be stimulate beta cells of pancreas, increase insulin, moves to the liver, muscles, adipocytes, and other cells. Here will be glucose transport, in liver will be glycogenesis, lipogenesis, and so on. And as a result, we have decreasing blood plasma glucose. Again, negative feedback connection we have with you, decreasing action of beta cells. Question: 26-year-old woman is complaining of sores and dryness in her mouth. The examination has revealed glucosuria and a blood glucose content 6.5. Glucosuria, it means that in the urine they find glucose. Normally, glucose in urine should be absent. So, of course, we are thinking about diabetes mellitus. And look, not so high level of glucose, 6.5. Opposite story, when glucose level in the blood is down, alpha cells is working of pancreas, increase glucagon, and glucagon take out from our storage all glucose for increasing level glucose in the cell. Next topic, what we are talking about calcium regulation. Calcium regulation, we are talking that calcium inside of our body responsible for coagulation, hemacoagulation. Calcium controls excitation of membrane in neurons and muscle. We have been studied that. Necessary for muscle contraction. We have been studied that. Necessary for releasing secretion all of hormones and neurotransmitters, and of course calcium is necessary for bones and teeth formation. Main regulator for calcium: calcitonin, parathyrin, calcitriol. In case if level of calcium in the blood is increased, this time we are talking about releasing of calcitonin by thyroid gland. Calcitonin will stimulate deposit of calcium in bones, will be also decrease absorption of calcium in the intestine, and will be increase releasing of calcium through the kidneys. 3 target organs: bones, kidney, intestine. That's all. Example of question: parodontitis is treated with calcium preparation and a hormone that stimulates tooth mineralization and inhibits tissue resorption. What hormone is it? We are talking, this is calcitonin. Other two hormones, parathyroid and calcitriol or vitamin D3. They're responsible for increasing level of calcium in the blood. First of all, this is parathyroid or PTH hormone, parathyroid hormones. How is working? When level of calcium is decreased, this time we have activation of parathyroid glands. Parathyroid glands release parathyroid, and this hormone will induce a degradation of bone matrix, and from bones will be released calcium in our blood. Also, together with vitamin D3 in intestine will be increased absorption of the calcium. Without vitamin D3, possible only 10% maximum use calcium from our food, from our meal. That's all. Without vitamin D3, you could eating so much different milk products and so on, but it will be not come to your body because will be deficiency of vitamin D3. Also, parathyroid hormone, the same three target organ, bones, efflux of calcium from bone, decrease loss calcium in urine, and enhanced absorption of calcium from intestine, but with vitamin D. This is important. Example of question. 2-year-old child experienced convulsion because of lowering calcium ions concentration in the blood plasma. Function of what structure is decreased? If decreased, first of all, we are talking with you about parathyroid glands. If they will ask about what kind of vitamin, for example, deficiency, we will choose with you vitamin D3. Vitamin D. Patient has hypocalcemia, decreasing calcium. What hormone deficiency may be its cause? Again, parat hormone. If hypercalcemia, we will talking about opposite hormone. We will talking with you about calcitonin. But here, hypocalcemia, we are talking about parat hormone. And example with vitamin D3. Humoral form of certain vitamin induces genome level synthesis of calcium binding proteins and enterocytes, thus regulating the intestinal absorption of calcium ions required for dental tissue development. What I told you. If they ask it about vitamin and calcification, we are talking about D3 vitamin. Next question. This is regulation volume of water and osmotic pressure. Three main hormone. Antidiuretic hormone. We have been talking about that. Antidiuretic hormone or vasopressin, aldosterone, and third one, so important hormone now so often using for treatment hypertension disease. This is atrial natriuretic peptide. Atrial natriuretic peptide, this is unclassic hormone. This substance released by atriums of our heart. Not by special gland, but by atriums of our heart. They have special secretory cells. They release this atrial natriuretic peptide. Vasopressin and aldosterone increase of blood volume and decrease osmotic pressure. Then more water, then less osmotic pressure. Atrial natriuretic peptide working opposite, it decrease water inside of our blood because of action through the its action through the kidney. kidney release more water under atrial natriuretic peptide. But how is it working? Why natriuretic? Because will be open channel for sodium, for natrium or sodium. Sodium moves outside, and I told you before, and again say you, where moves sodium, this side moves water, always in our body. If aldosterone working opposite. Aldosterone absorbed sodium, and together backside sodium moves water. Volume of water in the blood increase, but atrial natriuretic peptide release sodium, that why moves out water and blood pressure decrease. Example question. I had trauma in and around supraoptical and paraventricular nuclei of hypothalamus. Polyuria occurs. What result in development of the given phenomenon? Of course, we are talking about vasopressin. If we are talking about hypothalamus nucleus, we are talking about vasopressin. If polyuria happened, it means that not enough this hormone, this time we are talking about decreasing of ADH or vasopressin secretion. Second question. A patient has a decreased vasopressin synthesis that causes polyuria, and as a result of it, evident organism dehydration. What is the mechanism of polyuria development? If we are talking vasopressin has effect only on the water, not touching any other ions. Sodium is not touching under vasopressin. Aldosterone touching sodium. Atrial natriuretic peptide touching sodium, but vasopressin no, only water. That's why here we are talking only, you see, only about reduced tubular reabsorption of water. One more question. A severe injury in 36 years old patient resulted in significant blood loss, which was accompanied by blood pressure drop. Blood pressure is down after bleeding. Of course, this is logical and normal. What hormones provide a rapid recovery of blood pressure after blood loss? When we are talking about bleeding, we are talking about emergency hormone which working the first time. Here we have activation sympathadrenal system and releasing adrenaline or epinephrine. And second step, after few minutes, begin working vasopressin. This is second step. Third step, it will be working aldosterone, but it will be later. This time we are talking adrenaline and vasopressin. Controbiological regulation of osmotic pressure. Again, blood pressure up, more water. Osmotic pressure is down. Blood pressure down. Osmotic pressure is up. Osmotic pressure, concentration of soluble particles inside of our blood or inside of our blood plasma. What we have is if osmotic pressure is up, it will be also induce stimulation hypothalamus and releasing antidiuretic hormone, will become more water and blood pressure will be up, but osmotic pressure will be down. If it's not possible to make by internal regulation, it will be touching brain cortex, our behavior. We will feeling thirst with you and we will go and find water and will drinking water. Regulation, what I told you. Aldosterone working through the two mechanisms. This is sodium and potassium concentration. It depends on sodium and potassium. if sodium concentration in the blood will be down, or if potassium concentration in blood will be up. This case, we will have stimulation of aldosterone releasing. Releasing of aldosterone will induce absorption of sodium, absorption of water, and releasing of potassium. By this way, sodium potassium level will be normalized. Question. Some disease reveals symptoms of aldosteronism with hypertension and edema due to sodium retention in the organism. What organ of the internal secretion is affected on aldosteronism? When we are talking about aldosterone, this is hormone of adrenal gland, cortex of adrenal gland. Atrial natriuretic peptide, again, please pay attention. This is working with sodium and with water, releasing by atriums of the heart. If so high volume of the blood, this will be striated walls of the atriums. Atriums will release atrial natriuretic peptide, and this result will be releasing sodium through the kidney, and together with sodium will move out water. Example, atria of an experimental animal were separate distended by blood that resulted in a decreased reabsorption of sodium and water in renal tubules. This can be explained by the influence of the following factor upon kidney. What I told you, natriuretic hormone. A little bit few words about stress. Eustress, distress, this is different form of stress. Actually, stress, this is normal reaction of our body for the external or internal changes. Eustress increases possibilities of the organism, healthy life motivation. Distress, if so much stressful factors, decreases possibilities, facilitates disease development. Stages of stress, three stage of the stress. Alarm reaction. Here already what we have been learned with you, fight or flight system, sympathadrenal system working. Second, resistant phase, hypothalamo-hypophyseal adrenal system. And third one here, or adaptation or exhaustion. Here negative option drawing, possible adaptation, possible exhaustion. It depends on type of stress factors which put upside our body. For example, now all of you you are in stress 100%. Even if we not calculate some conditions of our life, we will talking that you prepare for exam. This is exam so important for your future life. That's why, of course, all of you have stress. And for you important now, if you will too much press it yourself, you will come to the phase of exhaustion, and so hard to renew from this phase. But if you will make regular training and physical and mental, if you will stable preparing for your exam, you will come to the phase of adaptation. 1 second. Short-term stress, this is sympathadrenal system. Long-term stress, this is hypothalamus pituitary gland stress system. Sympathadrenal, hypothalamus, hypophyseal adrenal system. Short stress, this stressful factor which affect you not more than 24 hours. From 1 second till 24 hours. For example, you see some accident on the road or something like this. This is stress. You worried about something happened. This is stress. But if you worried or some affect you during more than 24 hours, this is terrible story. And in this case, we are talking about long time stress. Adrenal gland, I remind you that we have medulla and cortex. Medulla produce epinephrine, norepinephrine, dopamine. Example from Krok question. 41-year-old male patient has a history of recurrent attacks of heartbeats, profuse sweating, headache. Examination revealed hypertension, hyperglycemia, increases basal metabolic rate, and tachycardia. All this effect of sympathadrenal system work. This clinical preservation are typical for the following adrenal pathology. Of course, we are talking about hyperfunction of what? Where we have releasing of epinephrine, norepinephrine by medulla. So our right answer will be hyperfunction of medulla. Cortex release for us, look, sex hormones in small quantity because main function this is for sexual glands, but also possible by adrenal cortex. Glucocorticoids, cortisol. Cortisol is responsible for a long time stress adaptation, and aldosterone, this is also responsible for long time stress adaptation and regulation of blood volume and osmotic pressure. Sympathadrenal system, brain cortex, limbic system again, hypothalamus. Hypothalamus sending signal to stimulation of adrenal medulla. We have releasing epinephrine, norepinephrine, and activation alpha and beta receptors inside of our body. When we are talking about sympathadrenal system, we have talking about intensification of carbohydrate metabolism, lipid metabolism stimulates, fatty acids mobilization from adipocytes. We are talking about hyperglycemia, glycogenolysis by hyperglycemia by glycogenolysis stimulation. So dividing of glycogen here. This is important. Why? Because now we are talking about long-term stress response. We are talking about glucocorticoids and mineralocorticoids. Long-term stress under glucocorticoids, we have gluconeogenesis, creation of new glucose, not from what we are eating substances, but from substances which we have inside of our body, a new glucose growing. That's why one of the main factors which induce diabetes mellitus of second type, this is long-term stress, because long-term stress increase automatically level of glucose in our body, and doesn't matter you eating sweet or not eating carbohydrate or not eating. Under your stress, your body will produce glucose by itself because need adaptation, need to survive. Increased blood glucose, suppression of immune system under glucocorticoids. Under glucocorticoids, we are have less allergic reaction. We have less, for example, respiratory infection. Our immune system like adapted and try to working opposite to everything for protect our body from the stress, for give us forces for solve our stress. But if this is so long time process, it will be happened phase of exhaustion. Our body will have so high level of glucose, it will be induced diabetes mellitus. Because all time inhibited immune system, it will be induced another problem. We will have problem with work of our immune system opposite to antigen different, and also anti-cancer effect will be decreased. Our immune system will be stopped its work under chronic stress. Look, glucocorticoid, cortisol effect. Protein catabolism increase, so will be muscle dystrophy, gluconeogenesis, what I say, new glucose growing, decrease glucose utilization, lipolysis activation, everything working for up our glucose level. Immune effect, anti-inflammatory effect, phospholipase A2 depressing, phospholipase responsible for prostaglandin production and leukotriene. So inflammation will be down. Interleukin inhibited. This will be induced depression of immune system. Also inhibition of histamine and serotonin releasing, anti-allergic effect. It seems like wow effect, very nice for our body, but it's not like that. If we all time will have depression of our immune system, it will be, again, I tell you, after exhaustion of our body, and so much illness, infection, and cancer disease will become to the body. And also look, support of vascular muscle sensitivity to catecholamines. All time little bit stress, and it will be more sensitive our body for catecholamines than in normal relaxed life body. After severe stress, patient was found to have eosinopenia. Eosinophils is decreased. Eosinophils is decreased. Eosinopenia. A decrease in the eosinophils number can be explained by the change concentration of following hormones. If decrease numbers of cells, we are talking about glucocorticoids. Also important moment that normally our stress hormone cortisol release by cycle. The highest concentration of cortisol should be at 7-8 o'clock morning, a.m. 7-8 a.m. If cortisol level regulation is violated, this is cycle changed this time releasing. And who have stress, I'm sure that sometimes it happened with you, or maybe not sometimes, often happen, that you awake in the night, 2-3 o'clock. You were sleeping after awake and feeling like you should be wake up. You not feeling needs that you should sleeping. 2-3 o'clock you cannot sleeping. Looking your phone, some video, something else, and cannot sleeping. And after a few hours, you begin feeling tiredness and you want sleeping. And instead of sleeping in the night, you're going to sleep 6-7 morning, 6-7 a.m. And after you not have forces for moves in your day. This is problem with cortisol. This is problem with cortisol. It means that have high level stress. Violation of cortisol, Cushing syndrome. This is not about stress. This is first of all about problem with pituitary gland. Excess concentration of cortisol. Symptoms: enlarged supraclavicular fat pads, moon face, red cheek, osteoporosis, hypertension, muscle wasting, obesity, cardiac hypertrophy, dark facial hair for the woman face, amenorrhea for women. This is all Cushing disease syndrome. Look for the question. 44-year-old woman complained general weakness, heart pain, significant increase of body weight. Objectively, moon face, hirsutism, blood pressure high, weight 103 kilogram for height 164. Here we are talking about obesity, we are talking about problem with we are talking about problem with cortisol. So reason, what is the main reason? Increasing production of glucocorticoids. And opposite story, Addison disease. This is when we have decreasing function of adrenal gland and decreasing production of cortisol. Bronze pigmentation, skin, changes in the distribution of the body hair, also for women, gastrointestinal disturbance, weakness, weight loss, hypertension, hypoglycemia. This is all testified about decreasing level of cortisol. That's all. Thank you for your attention. You have little bit time before next lecture for the rest. See you. Bye bye.
You have a good day.